first thing is to try and get the patients comfortable. When I first have my first meeting with them, I want them to know that they can come to us for anything.
It's the positive attitude, it's the energy, and when people come here, they're not just coming to get treated for a disease, they're joining a family.
In this office, definitely, it's always about the patient.
From the moment you walk into Colorado Hematology Oncology, you are family. We understand your concerns, and we strive every day to provide the calm and friendly atmosphere you need and deserve.
From the moment the patients walk in that door, we're ready to treat them immediately.
Patients aren't just numbers, they're real people.
The way they made you feel was like you were coming home.
We're all electronic, so the minute someone comes in, they, through the computer, alert us, the MAs, as to who's in the waiting room, so then we can pull up that patient's chart.
I learned the names of the girls at the reception desk that very first day.
So when I first met John Novak and Dr. Para, they were totally treated you like a person.
I think it's very obvious to anyone who comes in here what a family.
One of the first things that impressed me was a doctor that sat down with you and, basically, wanted to communicate with you as to, understanding what you wanted primarily, and then, talking about what the options were.
I mean, they really do care about their job.
The nursing staff is definitely a team. You can be working on one patient and know if you step away, the other nurse is going to be right behind you and know the plan and know exactly what to do with your patient.
People that apply to work here know what they're getting into, and they really want to be a part of that. So we don't really have to train our employees to be caring. They already want to do that when they come to work for us, and that's very good.
Colorado Hematology Oncology is very unique, obviously, because we treat the whole person. We're not just treating a disease or a disease state.
The attitudes of the people here are very important, and their skills. I mean, they're always very professional. If they have to react, they know exactly what they have to do.
Dr. Para is one of the best friends a cancer patient could ever have.
Patients are probably more aware now of the fact that we have the internet, we have news services, we have cable, so that many times we're hearing the forefront of cancer research. We're hearing some of the most cutting edge things that we're really doing and making a difference in long-term survival.
I told him, my desire for my quality of life, and Dr. Parr designed a program to be able to give me that.
Dr. Miller is an awesome physician.
One needs to make sure that you've covered all bases when you're formulating a treatment.
Well, if anybody ever needed an oncologist or the facility, I would certainly recommend Dr. Miller and this facility, because they've been very good to us.
I would trust Dr. Miller with anything.
Patients come here, they're here sometimes every day for weeks and months, and so many places that we've gone to are very, very sterile. Patients go into an infusion center and they're stuck sitting in a chair.
I had to go through an infusion center first, and it was just hard going through that, and it's way different, and I wasn't getting any of the side effect medications, and it would take them forever just to do what they can do here in no time.
We try to make the environment here as comfortable as possible, given the fact that they're here to try to cure cancer, and we think we've succeeded.
All of the cubicles here, they are designed very nicely to give you a sense of hominess, to give you a sense of relaxation. The photography that he has on the walls is beautiful. A lot of people in here watch television. Everybody has an individual television and headphones, but he does provide movies and television for those people who need that additional distraction to forget about what's happening here.
I mean, they give you the opportunity through their network here for me to access anything I need access. It's very productive. I mean, I can do anything. I can communicate with anybody. You have a cell phone. It's really an extension of my office.
Chemotherapy is a big step for patients. So again, we have to manage side effects. That's one of the top things that we want our patients to say. If I'm having an issue and what you gave me is not working to keep my nausea, vomiting down, come back and tell me, and we'll come up with something else.
Our diagnostics laboratory is cutting edge and state of the art. This is how our doctors monitor patient care and make the necessary adjustments to strengthen your treatment and maximize your care. Our facility also features the Advanced Cell Search Diagnostic System. Recently, our very own award-winning oncologist, Dr. Michael Para, was asked to speak about this amazing technology at the San Antonio Breast Cancer Symposium.
The CTC technology with CellTrax allows us to look at that change before it actually happens clinically. So we actually see changes in the blood of therapies we have patients on. Are they effective or not? If they're effective, potentially we can actually continue that same therapy with hopefully little mortality, little morbidity. Patients tolerate very well.
Colorado Hematology Oncology has 2 Denver locations to serve your needs, in the city of Inglewood on Hampton Place, and also in Lone Tree at the towering Sky Ridge Medical Center. This year, we plan on opening our most extraordinary facility yet, a full comprehensive cancer center in the South Park development in Littleton, complete with a PET scan and full diagnostic imaging center. We look forward to serving you there.
We're right down there with our patients, no matter what's going on, one-on-one with them.
They feel like this is a safe place to come, and they know they're in good hands and they trust us.
I love our patients, and I have learned so much from my life from them.